My name is Dr. Elena Vasquez, MD, FACS. 18 years of cardiac surgery at Cleveland Heart Institute. Board certified in thoracic surgery, fellowship trained at Johns Hopkins. Over 2,000 cardiac procedures performed. I've seen hearts stop, restart, fail completely. I thought I understood the absolute boundaries between life and death until November 15th, 2023. The ambulance arrived at 11:47 p.m. 43-year-old male, massive myocardial infarction. No pulse for estimated 40 minutes before paramedics arrived. They'd been performing CPR continuously during transport. When they wheeled him into Trauma Bay 3, I knew we were looking at a futile resuscitation. The man was clinically dead. Time since last pulse? I asked the lead paramedic while pulling on gloves. Approximately 1 hour, 20 minutes total, Doc. We got Ross twice in the ambulance, lost it both times. Last epinephrine was 5 minutes ago. The monitor showed asystole, flatline, no electrical activity whatsoever in the heart muscle. Standard protocol demanded we attempt resuscitation for 20 minutes minimum. I began chest compressions while my resident, Dr. Martinez, prepared the crash cart. The patient's skin was mottled grey-blue, pupils fixed and dilated. Body temperature had dropped to 94 degrees Fahrenheit. Every medical indicator pointed to brain death having occurred 30 minutes ago. "Push another epi," I ordered, continuing compressions. The ribs felt brittle under my palms, common in prolonged CPR attempts. "Martinez, check the airway." The endotracheal tube was properly placed, but the patient's lungs felt stiff, resistant to ventilation. Classic signs of post-mortem changes were already beginning. 18 minutes into the resuscitation attempt, I was preparing to call time of death. The family hadn't arrived yet. Probably better that way. I've delivered too many devastating news reports over the years. As I stepped back from the table, something made me pause. A slight movement in the patient's left hand. "Did you see that?" I asked Martinez, pointing to the patient's hand. "See what, Dr. Vasquez?" He looked confused. I watched the hand carefully. Nothing. Must have been muscle spasms, normal in recent death. I placed my stethoscope on the chest. No heart sounds, no breath sounds. The monitors continued showing flatline. "Time of death, E022, I announced, removing my gloves. Then I heard it, barely audible, but unmistakably human. A whisper. "Not yet." I froze. Martinez was across the room, documenting medications. The nurses had stepped out. Only the patient and I remained near the bed. The voice had come from directly below me. I looked down at the patient's face, eyes still fixed, dilated. No rise and fall of the chest. The monitors unchanged, still showing no cardiac activity, no blood pressure, no oxygen saturation. Yet I could swear I'd heard him speak. "Hello?" I said quietly, feeling foolish. No response. Auditory hallucinations aren't uncommon during stressful procedures. 30 minutes later, I was completing paperwork when Martinez burst through the door. "Dr. Vasquez, you need to come back to Trauma 3 immediately." His face was pale. "The patient, he's awake." I followed him quickly down the hall, assuming a mistake. Perhaps we'd mixed up the room numbers. Bodies don't wake up. The scene in Trauma Bay 3 defied everything I knew about medicine. The patient was sitting upright on the gurney, looking around with clear, alert eyes. His skin had returned to normal color. The monitors showed normal sinus rhythm, blood pressure 120/80, oxygen saturation 98%. Not just alive, completely stable. "Sir, can you hear me?" I approached slowly, checking the monitors again. Everything appeared normal, but this was impossible. "Yes, doctor," he replied clearly. "Thank you for trying to save me." His voice was strong. No signs of the neurological damage that should have occurred after an hour without brain perfusion. I examined him thoroughly. Neurological responses normal, pupils equal, round, reactive to light, no focal deficits, oriented to person, place, and time. "What's your name?" I asked. "Robert Chen, 1247 Elm Street, apartment 3B. My wife is Jennifer Chen. She teaches 3rd grade at Riverside Elementary. We have 2 children, Emma, age 7, and Michael, age 4. "Mr. Chen, you've had a very serious heart attack. We need to run some tests." I ordered an EKG, cardiac enzymes, and a head CT. Nothing made sense medically, but patient care came first. The EKG showed old inferior wall changes, but no acute abnormalities. His heart appeared to be functioning normally now. The cardiac enzymes returned severely elevated, confirming massive heart muscle death. Yet his heart was beating normally. The head CT should have shown signs of hypoxic brain injury after such prolonged cardiac arrest. Instead, it was completely normal. No swelling, no areas of decreased perfusion, no signs of oxygen deprivation. I consulted Dr. Richards, our head of cardiology. "Elena, this is impossible," he said after reviewing the case. "Look at these troponin levels. This man had a massive anterior wall MI. The muscle should be dead, and the neurological exam after 90 minutes without circulation. He should be in a persistent vegetative state." "I know what I documented," I replied. "A systole for 18 minutes during our resuscitation attempt. Before that, no pulse for over an hour. The paramedics confirmed it. Yet here he is, talking normally, heart functioning perfectly. I've never seen anything like it." Dr. Richards shook his head slowly. "There has to be a medical explanation." Over the next 2 days, I ran every test possible. Cardiac catheterization showed his coronary arteries were completely clear. No blockages, no signs of plaque. The echocardiogram revealed normal heart function. Blood work was perfect except for those initial cardiac enzymes, which were rapidly normalizing. It was as if his heart attack had never occurred. On the 3rd day, I sat with Robert Chen in his room. "Mr. Chen, I need to ask you something unusual. Do you remember anything from Monday night, before the ambulance came?" He looked thoughtful. "That's the strange part, Dr. Vasquez. I remember everything. I remember my chest-crushing pain falling down, and then floating above my body." "Floating above your body?" I tried to keep my voice neutral. Near-death experiences were commonly reported, though typically after brief cardiac arrests, not 90-minute episodes. Yes, I could see everything. The paramedics working on me in the apartment, Jennifer crying, the ambulance ride. I saw you and Dr. Martinez in the trauma room. "What specifically do you remember about the trauma room?" I asked. He described the room layout perfectly, the location of monitors, the crash cart, even the small coffee stain on my scrub top that I'd gotten earlier that evening. Details no unconscious patient could have observed. My hands started trembling slightly as I took notes. "I remember you doing chest compressions," he continued. "I wanted to tell you I was okay, but I couldn't speak. Then I remember deciding to come back. Not deciding exactly, more like being pulled back. And suddenly I was in my body again, and you were walking away." I excused myself and pulled his medical records. Robert Chen had never been a patient at Cleveland Heart Institute before Monday night. No prior admissions, no outpatient visits, no connection to our hospital. Yet his description of the trauma room, the resuscitation attempt, and even personal details about staff members was completely accurate. That evening, I called Jennifer Chen. "Mrs. Chen, this is Dr. Vasquez from the hospital. Your husband is doing remarkably well. I was wondering, could you tell me exactly what happened Monday night?" She described finding Robert collapsed in their kitchen around 10:30 p.m. She'd called 911 immediately. The paramedics arrived within 8 minutes. "Mrs. Chen, Had your husband ever been to Cleveland Heart Institute before? I asked. Oh no, never, she replied. We moved here just 6 months ago from Portland. Robert's never even driven past your hospital. We live on the opposite side of town. The only reason the ambulance brought him there was because it was the closest trauma center. I spent that night reviewing medical literature on prolonged cardiac arrest, consciousness during clinical death, and near-death experiences. The longest documented survival after cardiac arrest without neurological damage was maybe 15 minutes. Robert Chen had been without pulse for over 90 minutes. Medical science had no explanation for his recovery. The next morning, I found Dr. Martinez waiting outside my office. Dr. Vasquez, there's something else about the Chen case. I've been thinking about Monday night. Remember when you stepped back from the table before calling time of death? You asked if I saw something. What did you see? I thought I saw his hand move, I replied. But the monitors showed no activity, no pulse, no blood pressure, no electrical activity in the heart. It was probably just post-mortem muscle spasms. Martinez looked uncomfortable. That's just it, Dr. Vasquez. I was watching the monitors when you asked. For about 3 seconds, we had rhythm. What do you mean, rhythm? I felt my stomach drop. The cardiac monitor showed normal sinus rhythm for maybe 3 seconds. I thought it was artifact, maybe electrical interference. But looking back, that's when you saw the hand movement. I didn't mention it because I thought the equipment was malfunctioning. I pulled the electronic monitoring records from that night. Buried in the data, at exactly R01-1942, there was a brief episode of normal electrical activity. 3 heartbeats, normal rate and rhythm, then back to asystole. The timing matched exactly when I'd seen the hand movement and heard the whisper. Dr. Richards joined our informal case review. I've consulted with colleagues at Johns Hopkins, Mayo Clinic, even Cedars-Sinai, he said. Nobody has seen anything like this. The closest cases involved maybe 10 to 15 minutes of cardiac arrest. This man was down for an hour and a half. He should be dead. What's our discharge plan? I asked. Medically, Robert Chen was completely healthy. All tests were normal. His heart function was perfect. But I couldn't shake the feeling that we were missing something important. Cardiology follow-up in 2 weeks, Dr. Richards replied. Though honestly, I'm not sure what we're monitoring for. On Friday morning, Robert Chen was scheduled for discharge. I stopped by his room around 7 a.m. to do final rounds. The bed was empty, neatly made. The monitors had been disconnected. I checked with the nursing staff. He left about an hour ago, the night nurse reported. Signed himself out AMA, against medical advice. Did he say why he was leaving? I asked. He seemed anxious to get home, she replied. Said he had something important to take care of. His wife came to pick him up. They seemed happy but hurried. I felt uneasy. Patients don't typically leave the hospital at 6 a.m. after such a dramatic medical event. I tried calling the Chen home number around noon, disconnected. I drove to 1247 Elm Street during my lunch break. The apartment building existed, but Unit 3B was vacant. According to the building manager, no one named Chen had ever lived there. Been empty for 3 months now, he said. Previous tenants moved to California. Back at the hospital, I checked Robert Chen's insurance information and emergency contacts. The insurance card was legitimate, but when I called the company, they had no record of a Robert Chen with that policy number. The emergency contact number Jennifer had provided was also disconnected. It was as if they had vanished completely. I contacted Riverside Elementary School. They had no teacher named Jennifer Chen. In fact, they'd never employed anyone by that name. I ran a DMV check on Robert Chen with the address he'd provided. No records found. Social Security Administration had no record of his Social Security number. The man was a ghost. That weekend, I couldn't stop thinking about the case. I documented everything carefully. The initial resuscitation attempt, the impossible recovery, the normal test results. But now I had no way to follow up with the patient. No way to understand what had really happened. My carefully ordered medical world felt shaken. On Monday morning, I was reviewing weekend admissions when Dr. Martinez knocked on my door. "Dr. Vasquez, you need to see this." He handed me a newspaper clipping from the Cleveland Plain Dealer, dated 6 months earlier. The headline read, "Local man dies in car accident." Below was a photo of Robert Chen. The article described how Robert Chen, 43, had died in a single car accident on Highway 480 in May, survived by his wife Jennifer and 2 children, Emma and Michael. Services held at Lakewood Cemetery. The photo was unmistakably the same man I'd treated. Same face, same build, even the same small scar on his left eyebrow. I drove to Lakewood Cemetery that afternoon. The groundskeeper helped me locate Robert Chen's grave. Fresh flowers had been placed there recently, within the last few days. The headstone read, "Robert Chen, 1980-2023, beloved husband and father." Below that, "Until we meet again." Standing there in the cemetery, I felt something I'd never experienced in 18 years of medicine. Complete uncertainty about the nature of life and death. Everything I'd learned, everything I'd practiced, suddenly seemed inadequate to explain what I'd witnessed. The boundaries I thought were absolute were apparently more fluid than I'd ever imagined. I returned to Lakewood Cemetery several times over the following weeks. The flowers were always fresh, always recently placed, but I never saw who was bringing them. Security cameras had mysteriously malfunctioned during the times the flowers were delivered. Even in death, Robert Chen remained elusive. Dr. Richards eventually classified the case as unexplained recovery following massive myocardial infarction. The medical records were sealed pending further investigation. But there would be no investigation. How do you investigate a dead man walking? How do you research something that shouldn't exist according to everything we know about human physiology? 3 months later, I received a letter with no return address. Inside was a simple thank you note. "Dr. Vasquez, thank you for giving me the chance to say goodbye properly. Some things are more important than the rules of medicine. Jennifer is at peace now. So am I. RC." The postmark was from a city 3 states away. I showed the letter to Dr. Richards. He examined it carefully, then locked it in the sealed file with the rest of Robert Chen's medical records. "Elena," he said quietly, "some cases teach us the limits of our knowledge. This is one of them. We documented everything accurately. That's all we can do." I continued practicing cardiac surgery, but something had changed. Every time I declared a patient dead, I wondered about the mystery of consciousness. Where does it go? When does it truly end? Robert Chen had been clinically dead by every measure we have, yet some part of him had remained aware, able to observe, able to choose to return. 6 months after the Chen case, I began reducing my surgical schedule. The questions raised by that November night had grown too large to ignore. I started reading philosophy, studying consciousness research, exploring the intersection between science and the inexplicable. Medicine had taught me how the body works. Robert Chen taught me there's so much more we don't understand. I still work at Cleveland Heart Institute, but now I also volunteer with families dealing with unexpected death. I've learned to listen when they describe signs, visits, or communications from their deceased loved ones. Not because I necessarily believe, but because Robert Chen taught me that the boundaries between life and death might not be as clear as medical textbooks suggest. The Chen file remains sealed in Dr. Richards' office. Sometimes I wonder if other physicians have similar cases, patients who shouldn't survive but do, consciousness that persists where it medically cannot. But these stories rarely get shared. They challenge too much of what we think we know. They make us question the fundamental assumptions of our profession. Last week, I was called to consult on a cardiac arrest patient. 45 minutes without pulse, neurologically devastated according to every test. As I examined him, I noticed his wife sitting quietly in the corner, holding his hand. "The doctors say he's gone," she whispered, "but I know he's still here somehow." I looked at the monitors showing flatline, at the test results indicating brain death, at all the medical evidence of irreversible damage. Then I remembered Robert Chen floating above his body, choosing to return. "Keep talking to him," I told the wife. "Sometimes they can still hear us, even when we can't measure it." That patient died 3 days later, surrounded by family, after they'd had time to say goodbye. His wife thanked me for encouraging her to keep talking to him. "I know he heard me," she said. I believed her. Robert Chen had taught me that consciousness, love, and connection operate by rules we haven't discovered yet. I've been invited to speak at medical conferences about the Chen case, but I always decline. How do you present something that contradicts everything you've been trained to believe? How do you discuss consciousness persisting after brain death to an audience of scientists who require reproducible evidence? Some truths are too large for academic presentations. Recently, I was approached by a journalist writing about unexplained medical recoveries. She'd heard rumors about the Chen case. I told her the truth, that some patients recover in ways that medical science cannot explain, that consciousness might exist in ways we don't understand, that death might not be the absolute boundary we believe it to be. The journalist asked if I could prove any of this. I couldn't, of course. Robert Chen had vanished as mysteriously as he'd recovered. All I had were medical records documenting an impossible event, witness accounts from colleagues, and the memory of a man who'd been dead for 90 minutes but somehow found his way back to say goodbye. Tonight, as I write this account, I'm preparing to submit my resignation from active surgery. 18 years of cardiac surgery taught me how to restart hearts, repair damaged vessels, and save lives. One impossible patient taught me that there are mysteries beyond the reach of medical intervention, realities beyond the scope of scientific measurement. I don't know if Robert Chen was a ghost, a miracle, or something else entirely. I don't know how consciousness can persist without brain function, or how love can transcend death. I only know that I witnessed something that changed my understanding of life, death, and the space between them forever. The medical profession will continue advancing, developing new technologies, pushing the boundaries of what's possible. But Robert Chen reminded me that some boundaries exist beyond our current understanding. Some questions can't be answered with blood tests, imaging studies, or surgical procedures. Some truths require us to acknowledge the limits of our knowledge. Tomorrow, I begin a new career counseling families through medical crises. I'll help them navigate the intersection between hope and reality, between medical facts and human experience. And sometimes, when appropriate, I'll share Robert Chen's story, not as proof of anything, but as a reminder that medicine, like life itself, still holds mysteries we're only beginning to glimpse.